Good morning. This is Joanne Geer. I am the Executive Director for the Biopharma Research Council, and we welcome you to our webinar today on diagnosing drug manufacturing production issues, which requires doing three things well. I'm going to tell you a little bit about our organization, and then we'll begin. The Biopharma Research Council is a nonprofit association for scientists, engineers, and IT professionals across all the different silos of biomedical research, so which includes industry, academia, et cetera, but it also allows us to look at different diseases, different technologies, and so on. I'm going to share a little bit about what we've been doing this year, and much of it will come back again next year. We will actually next July 27th, we have booked the date, we'll be returning to the Internet of Medical Things, which will be looking at connected devices with a little different angle. It will include cybersecurity, which is key to developing any such devices, but we'll also emphasize more of on the engineering side. We'll be doing programs on diagnostics, and we are collaborating with the NIH on their program on the microbiome in the spring. We will return for the 6th year to the North Carolina Biotechnology Center for the Triangle Biotech Research Symposium. And our theme this coming year, it will also be on October 12th. The theme for 2017 is precision medicine, which will be an ongoing theme in all of our programs for 2017. And today's program is a teaser for our Regional Pharma Manufacturing Expo, which is happening on Thursday, November 17th at the Doubletree Hotel in Somerset, New Jersey. This is a new program for us, and it really wants to look at the interaction of new technologies, new discoveries, and all of the different people, process engineers, yes, IT professionals, biologists, and so on, who are working together to develop new drugs, and starting from the very early stages. You can't get a drug approved unless you can actually make it. So we're looking at the very, very early stages all the way through to patients. Excuse me, you can enter questions in your dialog box at any time during the presentation, and we will take all the questions at the end. I'm going to tell you a little bit about Dr. Locwin. Dr. Ben Locwin is an author of a wide variety of scientific articles in books and magazines and gives worldwide speaking engagements on healthcare topics. He is an expert contact for the American Association for Pharmaceutical Scientists, AAPS, a committee member of the American Statistical Association, ASA, and a leader in the Association for Talent Development's Healthcare Community of Practice. And you can follow him on @Ben Locwin. Dr. Locwin.
Thank you, Joanne. I'm going to show my screen here and then jump right in. Okay. So welcome. My talk, as Joanne mentioned, is Diagnosing Drug Manufacturing Production Issues, which requires doing these three things well. Now, first things first, on behalf of BRC and Healthcare Science Advisors, those who carried over to this morning's talk from Thursday, our apologies. We had some delays in scheduling, and we're really pleased that you were able to join us again. And so, again, sorry if you had made some time last week, and we're just being able to broadcast now. So an executive summary of what I intend to cover today. Why should your environment be properly established for improving processes? Are your programs effective? And if so, how do you know? And if you think your programs are effective, are you really sure, and how would you disambiguate that? How are you measuring? So I'll cover themes on data management, as well as understanding of a process. So what does it mean to have a process? Do you understand all of your processes? And then the third item, a no-blame culture, after which I'll go into a summarization and we'll take questions for answering and discussion. So first up, data management, the first of three issues to do well. So why is it important to do data management well? Principally because doing data management well is all about gathering better evidence. So data should be considered evidentiary. Now, better evidence generates solutions to production problems which are 14 to 20 times less likely to be incorrect or require rework. Better evidence also leads to repeatable solutions and not special opinions. So we don't want anecdote, we want evidence-based decision-making. Now, on the contrary, poorly made and/or low evidentiary decisions cost organizations $3,400 for every $10,000 of salary. So that's about a third, and that's sourced from Gallup. Also, poorly made and low evidentiary decisions across industries cost the economy about $328 billion annually. So again, these are decisions made without proper data collection, data management, and evidence backing the decision-making processes. Now, there's a big difference between the businesses that do this well and those that don't do it well. So this chart, which you see here, the companies in the top quartile of using better evidence for decision making have 60% fewer quality defects. So notice how the first 5 bars go below the null line. Safety incidents are reduced by about half in companies that use better data management and evidence. Absenteeism is down by just over a third in companies that do data collection and analysis properly. Shrinkage, which is inventory loss, down by about a quarter, as well as turnover. And importantly, too, productivity is boosted in organizations which use proper data collection, data management, and evidence-based decision making. Now, the perils of poor measurement. What does poor measurement have to do with data management? Well, clearly, if you're measuring in such a way that you don't actually know your data sources very well, you're not able to validate primary and source data for robustness, the problem becomes that the decision quality you're able to do is equal to the quality of your data. So with poor data quality at the front end, you'll have lower fidelity of decision quality coming out the back end. Now, this pertains to measurement quality. So how good are your measurement systems? And this begs the question, has your organization ever conducted measurement systems analysis? Now, MSA is often used across the variety of industries. Depending on which phase of pharma we're talking about, some phases in some organizations use MSA to a greater extent than others, but ultimately if you're not understanding the quality of your measurements, you don't really know the quality of your input data. And then the data management itself. So how good are your practices and policies around collating data, collecting the analysis, the archive, the ability to pull multiple sources of data in such a way that they can be meta-analyzed. And ultimately, good data management is a precursor and is absolutely a requirement for quality by design, which I'll talk a little bit about later. So if you're not really able to have proper knowledge management and data management, then it becomes very difficult to characterize your processes, to understand your defects, what they really are versus what anecdote might say they are. So data management and measurement quality become principal components of this. There's a bit of a statistical joke about averaging when you don't really have good quality data, and it goes something like, if you have your head in an oven and your ass is in a bucket of ice water, on average you're comfortable. So whether or not that's true, it remains to be seen, but just because you may have a high fidelity source of data on one end and a low fidelity source of data on the other end, you can't really average the two, and so that brings us to the perils of poor measurement and data management. Now, there are different types of cultures for which data management, knowledge management, understanding processes are done in a more robust way. So typically these are called risk-averse versus risk-seeking. And this comes from utility curves and assessment of utility curves in other industries as well. But really, when we talk about cultures and who are doing some of these things well, It's simply a matter of more immature organizations in the context of understanding measurement systems, data management, and understanding processes versus more mature organizations. Ultimately, as regulatory authorities scrutinize processes to a greater extent and time moves on and the whole industry evolves forward, companies tend to progress along this continuum where they become more mature at this. And the cultures in organizations which tend to be more mature are correlated with higher incidences of better data management practices, more evidentiary-based decision-making, so it becomes less about anecdote and gut feel and more about actual precise data and appropriate analyses. Now, making measurement for measurement's sake. Understand, too, that as far as collecting appropriate data, there's a universe of data out there. So on the left side here where we've got all these polygons, there's the universe of data, and in every case, our biases, our pre-selections, our filtering of data we predetermine essentially what makes it through to final analysis. So this is where subjectivity can sometimes be dangerous, because if we're entering into some problem to solution analysis, we want to make sure that we don't presuppose too many hypotheses before we've reviewed all of the data, because otherwise our subjective biases will filter out certain pieces of information. So information then becomes what we have after our biases, pre-selections, and filtering. So the universe of data becomes sorted information, and in this little Lego chart here we see that data are essentially source agnostic. Data are just what they are. Then we sort them, we arrange them, we present them visually in order to tell a story. So we want to make sure that we're doing this properly, otherwise we can't have appropriate decision making. So don't set up and execute collection of data for impoverished charts. Typically speaking, a lot of metrics, KPIs, process performance, there are lots of input data sources which don't necessarily belong in the final analysis. And then what happens is it becomes very difficult to separate out the most important principal factors which may have caused potential defects or discrepancies in the production process itself. And this could be at any stage. It could be anything from early phases of R&D through upstream manufacturing, downstream manufacturing, to vialing, lyophilization, anything like that. Make sure to measure the right things. The data always have a story to tell. And don't react without just cause. It could be that across audit bodies, there isn't much of a difference between what's being looked at and what's being found from year to year, from organization to organization. So null hypothesis significance testing would have us saying, if we don't suspect that there's a difference from one factor to the next or from one year to the next, then we shouldn't react to a degree which is not commensurate with what the data are telling us. So make sure that the data are giving you a story which then should point you in a direction through your decision analysis to make smarter choices as far as what would be solved through CAPA, what sorts of things you would want to look at versus not look at. And again, you won't have the resources and time to solve probably everything, and this is exactly where risk assessment and management comes in. So risk analysis, a brief primer. I'll cover just a few of the analytical tools and scientific underpinnings. So what is risk analysis all about? How is risk appraised, and why is it important? Well, principally it's all about what I have listed here, R, on the third line. So risk, classically defined, is the probability of failure times the magnitude of consequence. So what does that mean? It means that something, your potential risk impinging on a process or system, has some probability of going wrong. And this could be one or many failure modes. There's, in particular, failure modes and effects analysis, FMEA, which tries to categorize the severity, the probability of occurrence, and the detectability of issues. But ultimately, classical risk is probability of something going wrong. And if it does go wrong, you're multiplying by the product of the magnitude of the consequence. So if it does go wrong, how bad is it? Now ultimately this all leads to a systemic problem that can harm patients. At the end of the day, it's not just about a microcosm of manufacturing concerns, but it's more about what the patient-centric view is of all this. So the treatments that we produce in order to help cure diseases, treat diseases, change disease or disordered trajectories, those things are really what the whole industry strives to do. So we want to make sure that first we're causing no harm as best as we can. And then second, do we understand our processes and data well enough so that what we're doing can contribute repeatedly to success? So the graphic on the bottom, this is adapted from James Reason. He wrote a book in 1990, and this is called the Swiss cheese model of accident causation. And ultimately, now this moves from the right side of the graphic to the left, ultimately leading to patient harmed. So on the right side, you see that there's this arrow, this trajectory of things that could potentially go wrong. Now the Swiss cheese model calls into question all of the defensive layers that your organization has to prevent something from happening, which again ultimately could cause patient harm, patient death, real significant market risk, market challenges. So there are procedures, SOPs, policies. What we are calling employees to do is really important in order to understand, do we have the right systems in place? Are the procedures telling employees to do things in the appropriate way, which is why we have quality review of documents. There are physical barriers. Maybe it's personal protective equipment, PPE. There are things that prevent people from causing harm to the manufacturing processes. There are layers of training. There are layers of culture and behavior in organizations. And so some of the gaps, poor compliance, poor supply chain, inadequate knowledge, lack of training opportunities, a culture that doesn't understand necessarily the vision or the policy directions of the organization. And ultimately in the Swiss cheese model, what you'd like to do is add either more barriers, so more layers of this Swiss cheese, so that it becomes more probabilistically unlikely that patient harm can occur, that there can be a defect in the drug production process that can lead to rejection of a batch, or even worse, of course, the batch is released to the market, but then there are recalls or post-market surveillance data that there's an adverse safety signal. And ultimately, if you can't add more barriers, the other thing you can do too is shrink the size of the holes, because with some probability there's a rolled throughput yield that the problem will lead to some issue. So by having better procedures, better policies, improvements in training, changes in organizational culture, the holes can shrink, so again it becomes less likely that there are defects that make it through the production process. So why do we need formal tools to measure? Ultimately because we're human. None of the risk assessment and management tools in and of themselves solve problems, but they allow us to put something into an objective calculus engine, because we tend to have a lot of fallibilities and subjectivity when trying to estimate likelihoods and outcomes. Now Sir Arthur Eddington, who was a British astrophysicist, has a nice quote here. We often think that when we have completed our study of 1, we know all about 2, because 2 is 1 and 1. We forget that we still have to make a study of and, which is the operator between those two things, between the 1 and 1. So understanding the interface between different functional groups within an organization, between people who work within the same functional group, all these interfaces where there are exchanges of information and data are lost there. And this is really imploring folks to understand that we need to understand that between these interfaces where we're losing data, is there a better way to make sure that we're capturing things through each stage of the process so that we're not losing out on information that could be used to improve the production process, to increase the likelihood of success. Now in hazard loss estimation, any serious evaluation of risk takes into account the following 4 factors. So there's always, what's the hazard? Is there inventory involved? what's the vulnerability, and then ultimately the loss. So if you look at the blue circle on the right side, which is the inventory circle, as more of the inventory circle moves leftward into the hazard sphere, that's essentially the exposed vulnerability. So the magnitude of loss increases. So typically for supply chain, what we would want to do is have these circles, of course, separated as much as possible so that less and less of our inventory is exposed to hazard, which reduces our vulnerability. And this is a corollary of looking at production processes to the Swiss cheese model. A hazard's potential impact on the inventory is the inherent vulnerability. And the vulnerability of inventory gives a sense of the magnitude of loss. So again, understanding how much of the inputs of a process are exposed to hazard then starts to give us an assessment of how vulnerable our processes are to, let's say, batch failures, contaminations, and that sort of thing. And why is appropriate precision of measurement so important? Because ultimately unchecked subjectivity in approaches leads to inappropriate countermeasures. So in our industry, CAPA, corrective action, preventive action, are typically what are written to address defects and deviations. And if there's too much subjectivity and not appropriate data analysis, not appropriate data management and understanding of what's going wrong, then we can't assign relevant CAPA that are realistic. So we may think that we're solving things, but if we're not doing it in an evidence-based way, we've got more of a risk of either causing more unintended harm to the process than if we had just left it alone, or we're chasing things that aren't the principal factors in the deviation actually occurring. False alarm rates also drive mismanagement. So in the analogy of the smoke detector for type 1 or type 2 statistical signals, is there really smoke or do we just think there's smoke? So again, our rate of detecting has a significant impact on type 1 errors and type 2 errors. So do we have too many false positives? Do we think that there's an issue when there really isn't? Do we have too many false negatives where we don't think there's an issue even though there is? So understanding exactly where our data comes from and how precisely we're measuring and assessing risk is crucial. So how do people perceive risk? And it turns out in the literature that we don't, in general, perceive risk very logically. So unfamiliar technologies that have catastrophic potential, for example, nuclear power, cause people to way overestimate risk. And again, this ties back to the Sir Arthur Eddington quote. We have fallibilities and we produce errors when trying to estimate likelihoods and outcomes. And this is why we use structured tools to analyze our evidence. Now this misperception takes place at the expense of likelihood data. So there was a Wharton study where a group was faced with hypothetical managerial decisions. And in making these managerial decisions, fewer than 1 in 4 of the participants asked for probabilistic information. So that's less than 25%. And none of those sought precise likelihood data from the person who was running the study. So there was a proctor running the study. They could have asked these managers undergoing this hypothetical management decision could have asked for probabilistic information of something going wrong, and fewer than a quarter of the group asked, and none asked for precise likelihood data. And in a group where they were presented with precise likelihood data, less than 20% drew upon probabilistic concepts when making choices about alternate courses of action. So the majority, over 80%, didn't use the likelihood data at all in making their management decision. So again, deciding with evidence leads to better evidentiary decision. Now thinking long term, so how does this impact a production site? How does this impact a facility? How does this look on a broader scale? Well, in a situation where a company is considering flood insurance for the 25-year life of a production facility, managers are more likely to take seriously the risk of a 1 in 100-year flood if it's presented to them as having greater than a 1 in 5 chance of occurring in a 25-year period, rather than a 1 in 100 chance of it occurring during the coming year. So the probabilities end up being the same, but it really depends how it's framed to the managers. Homeowners in California purchase earthquake insurance most often after they personally experience an earthquake, even though those who did it responded correctly that the likelihood of a next earthquake was lower because there was stress on the geologic fault that had been reduced. So they're purchasing earthquake insurance after they experience it, and this is in stark contrast to how insurance should be purchased, which is prior to any significant event. So generally, we dismiss low probability events even if they're high magnitude of consequence. So this goes back to the risk model, probability of failure times the magnitude of consequence. If it's a low probability event with catastrophic potential, we generally dismiss these things unless we personally experience them, and then we try to recoup the losses later. Now, if we think about September 11th, 2001 in the United States, this perception of risk has an enormous impact on behavior. So after 9/11, a lot of people avoided taking airliners for travel for several months. And in fact, the data indicate that people changed flying behaviors for years afterward. So after 9/11, how many people drove to avoid death by airliner who then instead died by automobile accident? And this is interesting because the NHTSA has incredibly accurate control charts and databases about traffic fatalities in U.S. highways. So there are seasonal components that can be looked at via a technique called ARIMA. And what we find out is a sobering 725 more people died than normal in the 3 months following 9/11. So in 2001, October, November, December, if you look at the adjusted numbers of traffic fatalities, in those 3 months following 9/11, there were 725 more people dead in traffic fatalities than would be expected in the NHTSA data set because of increased driving habits, because they wanted to avoid death by airliner. So again, this is not using proper data to make unemotional decisions. So the risk of suffering a fatal airline event is 1 in 9.4 billion miles, and in an automobile it's 1 in 70.4 million miles. So still an individual is 133 times more likely per mile traveled to have a fatal event driving versus flying. But this is where subjectivity and emotional bias comes into the picture. Now, another tool that can be used is Monte Carlo. So probability distributions, which can run various simulations, so we can look at our processes and try to see a range of possible outcomes. So the Monte Carlo simulation is nice because it integrates risk and uncertainty into schedules, into processes, and it's well validated. So we can see if we would tend to fall in one tail versus another tail, and it provides us a good means of essentially assessing if we've made changes to our processes, what should we expect to come out of the back end of that. And in quality by design, we should have well-characterized processes with subordinate process steps that we can do these simulations with. Now ultimately, the risk management and assessment part of this seeks to address an ordinal list of potential business threats. So what does that mean? Well, we may have one of these 3x3 grids, for example, or it could be any number of stratifications that you like. There are a few caveats in how you slice the data, though, for proper risk assessment, which I won't get into here. I'll mention it more in the expo. However, if you have items that fall into the high category, you'd obviously want to address those first if possible. And now the ordinal list is essentially making sure that we're moving to the top those things which matter most. So in ICHQ9, there's a quote that the level of effort should be commensurate with the level of risk. So we would apply then more effort, more resource to those things which are more critical risks to the organization. And then it begs the question, for those below the top items, do we address all of them? And I would say that becomes something of a choice for organizations to make for themselves. We obviously can't solve all all of the problems and risks in an organization. Some will remain as latent risks, and hopefully those are the ones which, going back to the risk model, are the lowest probability of occurrence, as well as those that are the lowest magnitude of consequence. So we don't have anything that's extraordinarily consequential that could impinge upon our work, and we don't have things that are high probability of occurrence where they would happen very often. And then we can see whether or not we've made improvements through proper CAPA or process redesign. Potentially we change how policies, procedures are written, and we should be able to quantify all of the improvements. Now, stepping into what Walter Shewart, who was the creator of the control chart, what he said was to define those things that are the critical few from the trivial many. So in addressing those factors which matter most, and hint, it's not all of the factors, we want to separate out these critical few from the trivial many. So what does that mean? There are generally, if we think about the 80-20 rule, there are a very few, typically, number of causes which lead to the most significant impacts. That's not always the case, but there are often Pareto relationships in many, many processes and systems, and we see them all over, from management to technical processes to organizational discrepancies. And this is just an example of reasons why a subset of geriatric patients refuse to take their solid dose medication. So this is one where we actually analyzed real data in the field, and we collected information as to why geriatric populations refused to take tablets and capsules that they were prescribed. And when we first went into this analysis, the reaction from the host agency was, well, because you're talking about a senescent population, typically 65 years and older, 70 years and older, they're probably forgetting to take their medication. And so the initial gut subjective reaction was to go after the forgetting curve and say, well, how do we remind people? Maybe we need to send them text messages. Maybe they need to get emails and phone calls. And, you know, those unsolicited phone calls and messages tend to really turn people off in a marketing sense. But that's not what the data told us at all anyway. Instead, what we found was that when we looked at what reasons for non-compliance should we go after to actually fix, these are the data. So in first place, the dosing instructions for the patients were unclear. So they didn't actually understand when they should take this, if it was time of day or if it was QD versus BID or TID. The tablet size too large was in second place. So there's a higher incidence of dysphagia in geriatric groups, which basically just means that they have a harder time swallowing capsules and tablets. So again, this points to a totally different set of corrective modes than does forgetting. And then in third place is they're unclear on the benefit profile. It could be that because they're taking on average across the U.S. population more than 5.5 medications each, they're not sure which of their medications are actually crucial. Do they take them all? Can they just forget or skip some days? And so when we look across, just the first three factors out of everything looked at accounted for 75% of the effective non-compliance. And then way down the list, in 7th or 8th place there, is forgot or lost prescription or didn't have it filled. So we can address 3/4 of the non-compliance issues just with these first three items. So clarifying dosage instructions, it could be that the tableting is something that they could, for example, for a 50 mg dose, they could get 225 mg doses if the tablets were smaller, or there are liquid suspensions that in some cases can be used instead. And then clarification of the benefit profile is something that may assist as well. Now, as far as understanding how these risks can impinge upon us from different angles of organizations and in production processes, something called the Bullwhip Effect. So the error variance in our ability to produce the same sorts of documents in the same amount of time. So if we have a timeliness spec, to achieve the same timeliness spec from one site to another, or if we use CROs and CMOs from one organization to another, these things increase with different numbers of sites, different equipment, different teams, and essentially starts to look something like this. The more sites that are involved, it could be trial sites in the R&D aspect of the organization, it could be production sites in the CMO aspect that are all doing CGMP, however they're using subtly different equipment. It's different teams around the world. Understanding how these different input pieces of variance lead to greater magnitudes of variance in the back end is important. It's very similar to what you might see with a stock price spark line, where essentially you've got this cone of uncertainty that occurs. Typically that red X is, let's say, today, and then we're looking out for the next 24 hours, 72 hours at what a stock price might do. And you have a confidence interval in there, in some cases 2 or 3, but essentially you can't really know everything about tomorrow until tomorrow's here. The eminent physicist Niels Bohr had a quote which is, "Prediction is difficult, especially about the future." So the more sites we have, again, the more and different equipment we have, different teams involved in processes, make it very difficult to fully characterize everything that we're doing and to robustly plan on what the outcomes will be. And that's exactly the point of quality by design, to address that. Now this chart here is what the gravitational constant is when measured by different study teams in different organizations around the world. So even something like the gravitational constant, 6.67 times 10 to the negative 11th, with units listed there, there's a range in what different organizations in different places of the world have been able to analyze, and you can see some of those results there. So again, this is different sites, different equipment, different teams, etc. And the same happens with production processes in pharma. Now DJ Patil, who's a chaotician, he's now Chief White House Data Scientist. We had a conversation a few years ago, and he had coined what's known as the next 2 hours era. So he often cautions against trying to plan for years in advance because there's so much external environmental uncertainty that's going on. So as you can see, as time moves on here, just in this time axis arrow, 8 months, a year, 2 years, 3+ years, the uncertainty effect grows. So it becomes very difficult to get beyond this next 2 hours era. What's going on tomorrow? What's going on next week? What's going on next month? And that's why having repeatable processes, the right systems in place, appropriate levels of training and performance, the right measurements to then use to create corrective or preventive actions to fix things in a repeatable way. This allows us to know more and more about our processes. The external environment is so rapidly changing and uncertain, you'll have better business outcomes on average by better process understanding in your partnerships. Now this is a snapshot from ICHQ9. So everywhere I've put a red dot is where there's essentially intervention into a system to be able to make appreciable changes. So in this process flow diagram, there's initiate the process, there's risk identification, risk analysis, risk evaluation, and then risk reduction. Risk communication is the left sidebar, whether or not the risk is accepted or progressed for more work. All of these things have human intervention, have a risk of subjectivity, but also allow us to influence the process. So it's a double-edged sword of having freedom to influence and innovate, but at the same time also having some subjectivity which may not lead to repeatable conclusions. Now, understanding of a process. The process improvement guru W. Edwards Deming said, if you can't describe what you are doing as a process, you don't know what you're doing. So in all cases, everything can be characterized as a process, even if you think it can't. And where this fits in with quality by design was itself designed to strongly encourage, and we'll call that force, the industry to consider their processes for what they really are. So they're really processes, which means they have the ability to have repeatable outcomes. They can be quantified, they can be properly measured and analyzed, and you can look between the design space and try to find out exactly where the local maxima and minima are for proper performance of the process. Now, for those that travel frequently, we can also decompose that into a set of process steps. So you might head to the airport, there's an e-ticketing, and notice in all these cases, I've just repeated the graphic of the distribution. There are lots of situations where you've got the probability of having things being more optimum or less optimum. There's security, there's queuing, there's boarding a plane, there's the flight itself, there's landing and taxiing, baggage claim, taxi and limo, check-in to the hotel, and then ultimately what you end up with is some distribution which takes into account all of the potential variation from each of the subordinate steps. So again, in quality by design, you want to understand the amount of variance that occurs in each step so that you can properly characterize the repeatability of the final outcome. This may be something like in production processes that are CGMP, media fill, inoculation of a bioreactor, upstream processes, downstream processing, final fill. Now, interestingly, all of these can further be deconstructed into the subordinate steps within, let's say, media fill, within inoculation, all the steps within upstream processing, all the steps within downstream processing and final fill, and you can get even more granular. And ultimately, all of this can be applied, all this logic can be applied to any manufacturing issue. QBD subsumes that if you know what's happening at each step, the end result won't and shouldn't be a surprise to you. And this is a demonstration of proper risk prevention thinking. So the ability to prevent risks before they occur and before they can threaten the manufacturing process is absolutely critical. So after final fill, let's say on the left side here we have a distribution where the spec limit is the yellow vertical bar, and where that exists, we've got in most cases ability to meet whatever this particular specification needs to be. Now our capability here doesn't look like it's anything above 1, probably not even 1 for CPK. However, if you look at the one on the right, maybe this, again, this left skewed distribution where this spec limit is, this is a much worse process. So understanding, which side of the fence that we fall on. Is it something more like this, where we're frequently producing in a repeatable way within the specification, or is it something like the one on the right side, where there's lots of error variance and we don't have a lot of control what's going on in the process relative to spec. Ultimately, we want to take, if given the choice of the two, obviously the one on the left side, and we want to plan for success rather than planning to fix failure. And the third item, so we have data management as crucially important. We have understanding of processes as processes. And the third element, a no-blame culture. The majority of causes of deviations in the industry are not due to human error. There are systemic issues that occur and are allowed to recur because the systemic factors and the process-related factors are never appropriately resolved the first time. And for these, you need proper root cause analysis. You need appropriate and proper kappa programs so that when you identify the root causes, proximal causes, and causal factors, you can appropriately resolve those things that matter. And the right approaches for both RCA as well as kappa programs. So there are lots of tools which I won't get into now. However, there's more to follow at the Expo coming up this week. So we'll have more information and data about root cause analysis, proper kappa programs, and these three main themes to diagnose and resolve issues within your production processes. So in summary, key takeaways. Proper approaches to production issues must include looking at the current functioning. How well is there functioning of data management, knowledge management, the collection and measurement of data, understanding of processes, real understanding of processes, and a no-blame culture. Proper resolution to production issues must assess and challenge systems. So again, this goes back to the Swiss cheese model. So are the systems being appropriately scrutinized so that they can be optimized, so the systems are not allowing problems to occur and recur? This includes proper investigational approaches, and there is a right way to properly measure and analyze risks, as I mentioned. And ultimately, we are all the architects who can implement and or improve these proper practices. So thank you very much for your time, and if anyone has submitted any questions, I'll be happy to take those now.
Well, thank you, Dr. Locwin. This is fantastic. Yes, we have several good questions, and we have enough time. If anyone would like to add another question through your dashboard, you're welcome to do so. Let's see. I'm going to kind of work backwards. The most recent question we got was, what role does IT now play in enabling process control at the manufacturing level in pharma? Who designs the system models for the IT groups?
Oh, good question. You know, I've seen IT take more and more of a headline role in this now. It used to be that IT was put at the very back end, as you may be familiar. This was more the case, I would say, 15 to 20 and more years ago. They've, over the past decade or so, really kind of leapfrogged backwards earlier into the process so that they can really be an earlier component in understanding what's going right and wrong and helping to create these new systems that, again, are really designed as engineering solutions to prevent errors rather than trying to triage errors after they've already occurred. So what used to be something at the very tail end is now moving earlier and earlier. And this also has a lot to do, though, with different organizations and their different cultures and approaches to dealing with systemic issues, because in some cases it's still left to chance, but in a lot more cases than was ever seen before, IT is moved into a lot of the early steering committees to help design and structure systems in such a way that they're really allowing for the production of computer-generated systems that are really what the rest of the group is looking at doing. So it's not just a handoff, but they're more helping to make some of the earlier decisions, which has been nice. I would say in any case, the more systemic the solution can be, so if it's, let's say it's a computer intervention that prevents people from progressing to the next step if something hasn't been input correctly, that definitely works better than anything else that relies on human memory or anything of that nature, because we essentially want to prevent the issues from going wrong, and in a lot of cases these engineered IT solutions can do just that.
Thank you. Let's see, we have another great question. If one is a small virtual company working with CMOs to produce material, how would one know what process or quality controls a CMO is using in producing your product or precursor?
If there's already a quality agreement in place, or if there are discussions about putting together a quality agreement, typically those particular items that you're asking about and nuances of the production processes, those are absolutely amenable to being asked about and well understood. So it shouldn't necessarily be a black box between the host company or the molecule innovator and the CMO. It should be an open dialogue as to how the development process will actually work in practice, what sorts of equipment there are in the upstream and the downstream processes, and any potential issues that could be headed off early in the negotiation. So it could be, let's say, cartridge filters that the innovator company hasn't used or thought of versus what the CMO typically uses, things like that. So I would say that all of those are certainly discussions that can and should be had as part of the contract process.
Thank you. Here's another question. To what extent do big data and machine learning extend or ameliorate the next 2 hours predictions?
That's a good one. You know, before this webcast started today, we were just kind of batting around some ideas about, I guess you could consider big data. It was about meteorological forecasts, and even using Cray supercomputers, the best weather forecasting is really not much better than a 50-50 coin toss out to about 5 or 6 days. So the more, it's interesting because the more factors you're starting to involve in, let's say, your machine learning or your big data or your meteorological forecast assessments, you start to lose sight of the important statistical principle of parsimony, which is really stripping out non-significant factors, not adding more. So I think in a lot of cases when data sets get larger and larger, things don't necessarily get better predictive capabilities and qualities. Big data certainly has shown us a lot, especially in terms of pulling out observational correlations, but at the same time big data has suffered in practice from some real issues about folks trying to interrogate big data to find correlations for which they had no a priori hypothesis. So essentially that just means that trying to find correlations in a lot of factors of big data, you're going to find a lot of correlations just by chance because there are so many coincidental data pieces that are being looked at simultaneously. But if you don't have an underlying hypothesis to test, then it's not real science.
Okay. This one came in a little earlier, but I think it's a really interesting one and more broad. And this is going to be, I believe it'll be our final question. What are the strategies to avoid confirmation bias? That is, not only a measurement and analysis strategy, but also the mindset to question data even when it agrees with expectations.
That's a good question. And in a lot of cases, avoiding confirmation bias, especially when you're collecting real operational performance data, the best that can be done from a, let's say, a forensics approach is to collect all the data that are around the event. So it could be the event time window, those pieces of equipment, let's say, that are involved in the production process for where the issue occurred and prior to that upstream, and really start to understand, do we have every piece of data? And before we start trying to isolate any particular pieces of data, really lay everything out. If we think about it metaphorically, put it out all on the table, try to see if there are any natural relationships, but really having all the data there and having the data tell the story before anybody is allowed to say, oh, we've seen X, Y, or Z before, let's see if it has any relationship to that, because it may be that it has nothing to do at all with that, but those become very compelling questions which are difficult to unhear once they've been said. So once someone in a group says, oh, we should check on this because we've often seen that, those tend to pre-bias people very quickly, and like I said, it's hard to disacknowledge that that comment has been made or heard. So that typically draws people down potentially an incorrect path. So once all the data are there, then starting to look for correlations in the data which may be explained, maybe they're just correlations with no causation, but once the data are all there, before starting down a path of selecting a set of hypotheses, what could have happened, that really sets you off in a much better stead for preventing confirmation bias. And then I think once you've gotten all the data out there, once you have a list of at least several hypotheses to then test against the data to see which ones are more likely to have occurred because of the process versus chance or otherwise, that becomes a situation where you can test to see if you're experiencing confirmation bias by continuing to monitor the process after you've made corrections, because if you fixed things that the data seem to tell you should have fixed, and your process starts improving over time, you have now more evidence that you were fixing the right thing or things, and that it was a less random solution to your problem.
Well, this is a very good teaser for our conference and expo on Thursday. Thank you, Dr. Locwin. I just want to mention to everyone that if you're in the New Jersey area, it is very easy to register, and the whole program is free, including workshops. And it's rpmexpo.org is the website. And I will just mention to you some of the other speakers. David Pollard is our keynote. He's speaking on bioprocess vaccines in development at Merck. And additional speakers include Joanne Beck, who is the Executive Vice President for Global Pharmaceutical Development and Operations at Celgene, as well as Dr. Harapati Mati, Research Advisor in Formulation Development and CMC Development at Eli Lilly and Company. Thank you all very much for joining us today. Thank you, Dr. Locwin. Thank you, everyone, for your questions, and we'll see you on Thursday. Take care.